Hello, today we have Dr. Roy Liddick. He is the Assistant Professor, Department of Internal Medicine, Section of Rheumatology from Rush Medical College, Rush University Medical Center, also Director, Center of Clinical Biomechanics at St. Luke's Hospital in Iowa, and also a podiatric medicine doctor. So Professor Liddick is going to introduce the EXOS Insole for different foot pathologies.
So historically, when a patient walked in with foot pain and we did the examination on that patient, in our minds as clinicians, we knew what we wanted to do with that patient. And oftentimes it required fabrication of a foot orthosis. So it took time and energy to fabricate a foot orthosis. The patient would have to stay around for the 2 hours to fabricate that time. So instead, we would take a copy of that patient's foot, send that to a laboratory who would then fabricate that foot orthosis, and then send it back to the clinician who would then dispense the foot orthosis on the patient. Okay. The whole process was fraught with error, from casting of the patient's foot to get a copy of it, to writing the prescription to explain to the laboratory how to fabricate that device, and then at the laboratory the actual production of the foot orthosis could have error. So there was error along the entire process of fabricating the foot orthosis. What we really needed is to have a device that we could dispense to that patient right away. And this is such a device where we could actually look at that patient, see what's going on. In my mind, I know what I wanted to do with that patient, and then I could quickly adjust a device to fit that patient to address the need. Oftentimes, when a patient walked in, what they look like is that the rear foot was everted on the forefoot. And in my mind, I look at that patient and say, if I could just take that shoe and pull it back the other direction, or if I could take that patient's foot and pull it in the other direction, that would solve the problem that that patient has. And in fact, that's what this foot orthosis does, is allows me to do the same thing, to reposition that patient's foot quickly with low temperature thermosetting plastics. Oftentimes the patients walk in with plantar fasciitis, and that's where they have excessive stress across the medial fascia band on that foot. And again, it's from repetitive torsion of that foot on that fascia band. And the correction for that is to place the foot in a position that would take the stress off the medial fascia band. Oftentimes, when a patient walks into my practice, what I see is a foot that looks like the shoe twisted. Okay? And sometimes the shoes actually look like this too. And what you can see is, so the back of the foot is twisted on the front of the foot. This essentially puts tension across the internal band of the foot, called the plantar fascia band. Just like the shoe, the foot will go through that twisting motion. And as a clinician, what I want to do is take that foot and twist it back the other direction. All right? So when the patient's in front of me, I can see that that's what I wanted to do. If I could just take that foot and twist it back in the appropriate position, that's going to take the stress off that medial fascia band. And that is exactly what this EXOS material does. It allows me to place that foot in the appropriate position right away while that patient's in front of me. So there's no more need to send that copy of that patient's foot out to a laboratory, wait 2 weeks to get it back, and hope that it comes back with the appropriate corrections without any errors. So the EXOS material is a low temperature thermoforming plastic. Low temperature meaning that instead of the high temperatures required to set materials like polypropylene, we can do that within physiological limits so that this temperature can be placed up against the patient's foot. The EXOS Corporation was famous for developing low temperature thermosetting plastics, and they used it primarily for the hand and upper extremity, basically using a boa enclosure to tighten it down. They then decided that they would develop similar plastics for the lower extremity. The difference between the upper extremity plastics and the lower extremity plastics, of course, is the amount of force that goes through the material. So they had to come up with new composites that included carbon nanotube technology to accept some of the rigid forces that go through the lower extremity. Being low temperature means that it heats up relatively quickly, and it also cools down relatively quickly. What that means in a clinical setting is a decreased amount of time of seeing your patients. So I can heat this up, adjust the shape of this device to the patient's foot, and it'll cool down quickly within 30 seconds. So that means that I can adjust that patient's foot orthosis, get it onto the patient, and have them try it out in a short period of time so that I get a patient feedback right away to let me know, is this appropriate? Is this working for this patient? One of the benefits of having low temperature thermosetting materials is when that patient's in my office, I can see their problem, I can visualize what I want to do with that patient, so I can go ahead and do the treatment right here, right now, with that patient's in front of me. I can do the adjustment and have the patient walk out of my office pain-free. The alternative to that is I take a copy of that patient's foot, send it to a laboratory, wait 2 weeks, and the laboratory sends the orthosis back. I then dispense it to the patient in hopes that it's appropriate. If there's any error in the fabrication of that device, I'll have to adjust it by sending it either back to the laboratory or have the patient try it. With the EXOS material, I can go ahead and adjust it and correct it on the fly, have the patient walk, come back, adjust it if needed again, and again walk out of the office pain-free. So currently, there are many off-the-shelf devices available to treat various foot problems. They're fairly inexpensive, usually made out of foams which compress over time. The other alternative is where you take a cast of the patient's foot, either with laser or with a cast, plaster cast, and then you send it to a laboratory and they custom fabricate the device to fit that patient's foot. This is relatively inexpensive, of course, and this is fairly relatively expensive. So right now there's not much in between these two devices. That's why the EXOS Thermoformable orthotic is a better orthotic to fit that gap between the two. Out of the box, the EXOS material has a top quality shape. The EXOS orthotic has a top quality shape to it that is better than most off-the-shelf devices that are out there currently. And that shape is going to be beneficial to a majority of the patients that you see with foot problems. That shape, of course, is dependent upon the curvature of the heel cup, the arch, and of course the forefoot. This shape by itself will easily address 80% of the foot problems without any adjustments. But what's special about the EXOS material is that it is easily adjustable. So for those 20% of patients that the shape might not be appropriate, it's easily adjustable and customizable so that the patient will ambulate relatively pain-free and walk out of your office as a satisfied patient. Historically, we had high temperature thermosetting plastics as a material that was available to us, which limited the ability to fabricate a foot orthosis. To utilize these high temperature orthotics, we had to take a copy of the patient's foot through casting, either plaster casting, biofoam boxes, or most currently laser topographical scanners. Then we would take a copy of that patient's foot and send it to a laboratory who would then utilize these high temperature thermosetting plastics to fabricate the foot orthosis and then ship it back to the clinic for dispensing to the patient. With these low temperature thermosetting plastics, we can do it right when the patient's in the office, applied against the skin since it's in physiological temperature range. The patient can then wear it with ambulation to give us real-time feedback to whether the device is working to offload that patient's foot.